Now I want to introduce the Minister of Health for the state of Kerala, KK Shailaja. Madam Shailaja, after your initial success, I mean Kerala was that sunshine state which was able to contain the virus, at least initially, especially because of its learning from Ebola. But Kerala is now witnessing a second wave, and a very strong one at that, as far as COVID cases are concerned. Ms. Shailaja, what happened?
Yes, we anticipated the second rise. But after the lifting of the lockdown, the system changed completely. I think Kerala is having one of the longest drawn epidemic in the world and in India also. The first case in Kerala occurred at January 30th, and that is the first part, that is in January. And from up to May 3rd, we have 499 cases, and in that 33% is locally transmitted, and we cured all except 3, and the mortality rate at that time is 0.5. And we anticipated a rise after the lifting of the lockdown, because as you know, the number of the expatriates is very high in Kerala, and 10 lakhs people returned to Kerala when the lockdown returned from other countries and also from other states of India. The other part also is the epidemic is rampant in Tamil Nadu, Karnataka, etc. And the Keralites returned at that time from all parts, by air, by water, and by road, and by railway. And we have very good system. Our strategy is, the first one is to trace, quarantine, test, isolate, and treat. And the second is to break the chain, to contain the spreading of the virus. And the fourth one is reverse quarantine, to protect the most vulnerable people from the virus. And we started pre-preparedness for facing this new problem. But it was more, we cannot say more we expected, but it is more. And when the people came from outside, the positive cases increases, and also this kind of spreading also increased. Now, the one thing we should mention is that the clusters formed here and there, and we formed a cluster management strategy, and we are trying to contain these things inside the cluster. And we are locking down the cluster and also supplying the medical team and medicine, everything in that cluster. And we are trying to contain the spreading of the virus. And we can do that. There were some of the clusters we contained successfully, but at that time another cluster is occurring in another part. That is why we are struggling, but we are doing, and our preparedness is also helping us this time also. We have more than 83,000 beds in government sector, and I think almost 65% is vacant this time also. And we have more than 2,883 ICUs in government sector. Out of that, 55% is vacant this time. And we are trying new methods also. We are treating the asymptomatic cases in home. Treating in home doesn't mean sending them home helplessly, but each and every primary health centers is in charge of that, and they should every day they should keep in contact with that person who is quarantined in home. And we are successfully doing that, and people are curing from the homes, and we are checking whether the quarantine principles are obeyed by them, and they are not jumping the quarantine. We are thoroughly watching them with the help of local self-government, local help governments, ward committees, etc. And also police also is helping us, and we are doing that. And the mortality is when the
can I just ask you a follow-up question, Pranoy here? Sorry to interrupt. I just wanted to ask you a follow-up. But just before, I don't know if you heard the governor of West Bengal come on here at a time of crisis and bring politics into this show. This is not a place for politics. This is not a time for politics. And in any case, a governor should not indulge in politics. It was wrong of him to do that. Ma'am, putting that aside, Kerala is suddenly seeing this spurt. How are you going to control it? It was like very, very, very few cases in Kerala. Now we are seeing it in thousands.
Yes.
What has caused it, and how are you going to stop it?
Definitely. Definitely, that is the most important thing. We insist all of them
Yeah.
to obey the quarantine principles and health department's guidelines, etc. But some people are taking it as politics, huge gathering of the political protest groups, etc., without wearing masks and without obeying the guidelines of health department and government. And that was a threatening thing, actually. And after that gatherings, definitely the cases increased much, increased several folds it increased. And that is the main problem. I just want to mention it here, and it is not fair. And that kind of politicalizing the thing is a very difficult thing to contain this virus. Now itself, Kerala, the death rate or case fatality rate is 0.4. That is a very lowest rate amongst the world. But if the people behave like this, coming out and they are not willing to obey these principles, etc., that will make a very difficult problem. And we appealed our opposition and others, please help us to contain this pandemic first. And after that, we can shout against each other. And if you want to show your protect, please obey the guidelines. 5 or 6 people with 2-meter distance and wearing masks, they can do anything. But hundreds of people coming together and shouting slogans. When shouting slogans, it's a difficult thing. As you know, the particles or this saliva, etc., will spit over the other man. And if anyone is positive in them, the other people also become contracted. And that happened also. In that protest group, so many people become positive. They are not becoming, but other people are also getting the virus. But in the group, someone are getting positive, and the all other people are now under quarantine, and we are watching thoroughly that. And the positive cases, number of positive cases also reached several folds. That's a difficult thing. First of all, actually, the COVID-19 has a litmus test for the human being, for all the governance system throughout the world. And we all togetherly, without any disparities of caste or creed or color or politics, the human beings should stay together to fight against this virus first. Then only we can fight against politics and other things. The first thing is to save the lives of the people. Then only we can fight in future. Without our life, can we fight against future times? And our Honorable Chief Minister and as Health Minister, I several times appealed them, don't make this disturbance. Please, we can together meet this crisis and we can solve. Now they, amongst one of the UDF, they said that they are stopping this joint struggle and joint protest. They are stopping that. That's a good thing, and we appreciate them for that. But it should be go to grassroots level, and every political party to teach their followers in the grassroots level itself that this is the time to unite, to fight against the threatening virus and to save the lives of the people.